everyone. I have not done a live and I can't tell you how long. I know I promised them about certain subjects and then life just gets crazy busy. I am excited though. Today I get to talk with a doctor from FAIR. One of the leading organizations in the food allergy space, and ask her specifically about school and food allergies. And obviously this is incredibly important to me. I have two kids, one in preschool, one in going into second grade. His first grade year just wrapped up. Cannot believe it. But Dr. Cleary is going to join us really, really soon. We are going to be talking about expanding food allergy care access for school-aged kids. While we're waiting on her to come, let me tell you two things. Well, two disclaimers, okay? One, my kids are still awake and my husband is trying dearly to keep them upstairs for me. But if they run into the background and say something crazy, that's just being live, okay? So apologies in advance. Second disclaimer is that this session was developed by Vindico Medical Education and FAIR with educational grant support from Genentech, a member of the Roche Group. And again, Dr. Kelly Cleary is going to be joining here in just a little bit, and I'm excited to ask her so many of these questions. Let me look and see if I see any kind of request from her to join. I don't see it yet, but as soon as I do, I'm going to accept that invitation. And while we wait, I don't know if y'all followed my Instagram stories today. It was just the craziest timing that we're talking about this subject today on Instagram Live, because I had to pick up my kid from school today. Got a call from the nurse, the dreaded call from the nurse, that my son was having itchiness in his mouth. His mouth was bothering him. Said he was a little dizzy and nothing progressed. I don't think it was actually allergy, but it's just that pit in your stomach drop feeling when you get that call from the nurse, and then especially when they say that their mouth is hurting. I tried to stay calm. We talked through it. There weren't many other symptoms going on, so we tried to wait it out, but then it was still bothering him. And I was so proud of him for trusting his body and, going to the nurse and telling them what was going on. And thankfully nothing progressed and he is perfectly fine. I don't know if it's, something weird he ate, or if he's just being a kid. Maybe he's coming down with a cold, oral allergy syndrome. Who knows? It's always a guessing game. But it was just a crazy timing situation that I'm talking about allergies in schools tonight on Instagram Live, and listen to what just happened to me. Okay, I see that Dr. Cleary is ready to join. Let me see this. Go live. Okay. Do y'all see her yet? I'm not seeing her quite yet. And by the way, guys, like I said, I have some questions that I want to ask. Oh, hi, there she is. But then afterwards, if we have time, I'd love to answer y'all's questions. So whoever is here, you can share this live so that more people can join in. And then also, anything that strikes your interest in this conversation, please put some questions in the chat and we'll get to them. And even if they don't get to them in this live portion, maybe Dr. Cleary can answer them in a comment or something like that. Would that be okay, Dr. Cleary?
Absolutely. Yep.
Okay, great. Welcome. Thank you so much. I already introduced you once when I hopped on a little bit early, but I'll do it again. Dr. Kelly Cleary is the medical director at Food Allergy Research and Education, better known, of course, as FAIR in McLean, Virginia. And today we're going to be talking about expanding food allergy care access for school-aged kids. Dr. Cleary already gave the disclaimer, first of all, that my kids are upstairs and my husband is struggling dearly. I know you know, because you're a food allergy mom yourself. I'm just hearing screaming left and right. I'm like, oh my gosh, please don't ruin this interview. But if they do, I feel like you would understand. And most of the people probably on
Yep.
live.
And it goes back to you. I've got 4 roaming around and a dog, and I'm really not sure where my husband is. So at least yours is with him. He's somewhere.
Yes.
I don't know.
Yes. Yours are a little older, right? How old are your
Yep.
kids?
So my youngest is 10. I'm 10, 11, 13, and 15.
Wow. That's a lot of kids.
A lot of
I
kids.
think we're
Yep.
stopping at two.
You never
Um,
know.
yeah, I guess that's true. I guess that's true. And you have one kiddo with food allergies, right?
Yep.
Can
My
you,
13-year-old son has multiple. He's allergic to egg, peanut, and
oh,
shellfish.
goodness. When you have a list longer than honestly any food allergy is too many, but I feel like when you have multiple that you're dealing with, it's brutal. It's tough.
It It is. And I think, at one point in his life, we were avoiding so many more foods. And even through FARE, just talking to families that are struggling with, some of them 5, 6, 7, and more food allergies, it's a lot, right?
Yeah.
But I think that on the other side of that, the kids that I meet through FARE, the teens and young adults, the resilience that they have is just, it's inspiring. So
Yeah.
I always look at both sides. Like there's that struggle, but on the other side, real true resilience.
Yeah, I always say I wish they didn't have to be resilient, but I mean it is a silver lining for sure. Okay, well, I could chat your ear off all night, but I know that we have to get to some questions. This will going to be like a short question and answer. Like I said, guys, if you have any questions for Dr. Cleary, like she's the expert here, so put them in the chat. We can ask those. But first, let me start with kind of some basics. What would you say are some of the ways that healthcare providers can help with managing food allergies at school and then alternatively also at home? Like what should or can a allergy provider or even a pediatrician do to help families?
So I think the first thing, and I actually just talked about this with Ina when my son was diagnosed 13 years ago, we had no
Yeah.
options, right? There was not an option around. And truly, every time we went into an office, it was avoid these foods to keep him safe. And that was like the opposite of what I knew as an ER doc, where it was take this med every 12 hours for 5 days and you'll be better. This was go home, read every label, and make sure they're okay. Now we have options, right? And that is it's I'm so hopeful for it, and I'm so grateful to be in the allergy community at this time. So that's the first thing, is to really engage in shared decision making, because it's not just avoid the allergen anymore. By going to your pediatrician may say, you know what, you've never seen an allergist, but now there are new treatments, right? There is You can do oral immunotherapy. You could look at biologics. There's more to offer now. So that's the first thing I think that pediatricians can do. And the second, I think, is really delving into the psychosocial a little bit. I think that, we see, in our own kids that these kids sometimes are getting bullied, and the rate of bullying is 1 in 3 kids with food allergies. But really asking those kids, what's it like in school? Have you ever felt this way because of your allergy? And I think just taking that next level, and then giving you the guidance and helping you fill out your forms and your prescriptions to keep up to date and not expired.
Yeah, no, all good advice. And like I like to set reminders in my phone for myself too, just to like, every like month before it expires, like
Mhm.
send my iPhone alerts out to myself. So anything and everything to help you stay on top of that
Yep.
stuff, I know.
Yep.
What about meeting with schools? I mean, I know I stay in constant communication with my child's teacher, but especially at the beginning of the year or someone entering kindergarten with their food allergy kiddo, what are some things that you suggest that food allergy parents talk with their school or like whether it's in administration or directly with their teacher, the school nurse, like what should we be considering and asking about when we're meeting with these people at school?
Yeah, so I always think about, in food allergy, moms, dads in particular, like there's a study out there that looks at when is our anxiety heightened, right? And there are a couple of different points, after a reaction, if there's a new allergy, but the other thing is
Mhm.
transitions. And I think that any food allergy parent you talk to, and I have three without food allergies and one with a food allergy, the transitions are so much harder for me to go through with him because there's so much more on his plate.
Yeah.
No pun intended. So when I go into schools, I have my list of questions that I want to know, and it really varies depending on his age. It's different now that he's in middle school than it was when he was in kindergarten, but there are some really good tips that you can ask everyone uniformly. The first question I always ask is who's trained to give epinephrine, and really finding out how many people. I am really, really fortunate to have had wonderful teachers, wonderful schools, but there have still been schools that we've been to that have one or two people trained. So that's where I'll say, maybe we need a little bit more and we need more people trained, because what happens if you're not here? I always ask where they're keeping that epinephrine, because we may be giving it in, or they may have undesignated stock epinephrine there. But where you're keeping it is important, because if only two people in the building know where it is and it's in a locked cabinet, that could be an issue. I'll always ask about where they're eating. Are they eating in the classroom? What are the policies in school? Can people bring food in for anything? And if the answer is yes, because we've been in schools that has been, I've always asked just for a heads up, for a warning, right? Because I would like to be able to provide him something that's equivalent to that, and something that he can bring in and enjoy a snack. And then I do ask about, now he's in middle school and it's a lot harder because he's eating from the cafeteria with those allergens. But again, when you talk about resilience, I get a smile on my face anytime he says, "Oh yeah, I got the chef from the back and I asked him, does this have egg in it?" So, it's those little wins. But I do think really going into school, talking to the teachers, really knowing the policy about who's trained, what do you do in an emergency? What are those preventive tactics that you use throughout the year? And then really communicating those things broadly.
Yeah. I feel like you touched on some of these things already, but my next question would be, what sorts of things can we do to help make school more inclusive for our food allergy kids, and certainly safer, right? It's like safety is number one. I get that. But for me, like making sure my kid is included and not like just devastated that they didn't get the same thing, the cupcake that was specially brought in, like that hurts my heart. So like what can we do to help make sure that it is an inclusive environment and also safe?
So it's interesting because safe doesn't equal inclusive, right? And that actually took me a little bit of time to even think about, because sometimes I would send him and just want him to be safe, but that's not the answer, right? Like we've had sometimes people push back and say, well, maybe he could eat at the table alone, or maybe he could, and that is a true story. Kindergarten, someone in even my friends circle suggested that. But really, when you're looking at inclusivity, it's how could we do things as a group that everyone could participate in? And I think that schools, there are a lot of schools now that they're really trying to work that out, right? Where the class moms are emailing around and saying, well, what can we bring in as a snack? And I remember having this conversation actually with a mom who had kids in college, and I was like, my son has never had a cupcake ever at a birthday party in a classroom. He's allergic to egg, and we can't, like, he cannot eat baked egg. And her face went flat because she said, well, what about when he went to birthday parties in school? I'm like, can't eat it. And she's like, but
Right.
I would have sent an ice pop. And so sometimes I think it really is just about awareness. So rather than giving out food, giving out trinkets. If it's someone's birthday, my son, somehow managed to get 15 minutes of recess extra for every birthday in the class. Hopefully their GPAs are still as high, but there's so much that we can do to really keep it inclusive.
Yeah, and you're right. It's just so important, and I think most people do want to help. They just don't know.
Right.
If you don't live this life every single day, it's like
Exactly.
you don't know. I have friends that once they figured it out, once I explained it to them, I mean, they just went above and beyond for me, and even people I didn't even know that well. So it's like, yeah, you just have to advocate, you have to ask, and all of those tips were great. Thank you so much. Do you have any allergy resources that you'd recommend for families and schools, something that can kind of keep them up to date on the latest and greatest, or yeah, help with these things we've been talking about?
Absolutely. So we actually just, if you the CDC's guidelines for food allergy is that long 100-page plus voluntary guidelines for food allergy in school. It's a wonderful document. But we actually worked in partnership with the AAP, American Academy of Pediatrics, and the CDC to convene a group of experts and whittle that down to something that's more digestible. And just, the advice is there. It's called FAMS, Food Allergy Management in Schools. So if you went to foodallergy.org and typed in FAMS, you'd see this 30-page document. And what we did was really take resources from all of the different food allergy advocacy groups, ones that we saw that were out there that were really great, whether it was for students or for the teachers or administrators or food service staff. So many resources, and we've got Fair Check on our online site to teach food service workers. So there is so much out there that can be offered to schools.
Okay, well, I'm personally going to check that out because I feel like I've been at this food allergy thing a long time and had not heard about that resource. So thank you so much. I think a lot of people are going to be clicking that link, and I'll share that in my stories as well. Okay, we are kind of running out of time, but I want to make sure that if you guys have extra questions, certainly put them in the comment section. I'm going to post this in my feed, and then it's also going to be placed on Vindico Medical Education's Instagram and YouTube pages. So if you missed anything, if you joined late, just hop on there. It'll be up certainly by tomorrow, but probably this evening, so you can hear everything that Dr. Cleary had to say. And of course, she's not done. She has one more Instagram live with our friend Jenna over at Jenna X Health. That starts pretty much right now. So please hop over to her page. Again, I'll put that in my stories as well so that you guys can know exactly where to go if you don't follow her already. But they're going to be talking about navigating food allergies as a young adult in college. And even though mine are only 4 and 7, it's like, college is going to be here in a snap. So,
Yes.
I mean, and it worries me. It's like they're under my roof right now, but in college, they're on their own.
I remember my
So,
son was probably 3, and I remember one night sitting before going to bed and almost tearing and saying to my husband, "How's he going to go to college?" My husband's like, "He's got some time." And I'm like, "No."
I know. It's like, oh, my husband's always talking me off the ledge like that too. But that's what we do as food allergy
Yep.
moms. That's normal.
True.
Okay, well, Dr. Cleary, thank you so much.
Thank you,
I hope this was
Sarah.
helpful. I know it was to so many people, and good luck in your next conversation.
Thank you for having me.
Bye bye.